Today, we're talking about pharmacokinetics. Now, that's a mouthful, but it's really just a fancy way of saying we're going on an epic journey. We're going to follow a single pill all the way through your body, from the moment you take it to the moment it's gone.
I mean, really think about it. You pop a pill for a headache, and a little while later, poof, the pain is gone. But what on earth is happening in that black box of time between swallowing it and feeling better? It's definitely not magic. It's an incredible biological road trip.
And that whole adventure has a name: pharmacokinetics. As I said, it sounds super technical, but it really just boils down to one simple question. What does the body do to a drug? It's a journey with 4 distinct stages, and we're going to break down every single step.
Okay, so before our little pill can even get started, it runs into its very first roadblock. To do absolutely anything at all, it has to get past the body's bouncers, its internal security system.
And that security system is what we call the biological membrane. You can just think of it as a gatekeeper that surrounds, well, pretty much every cell and tissue you have. So for a drug to get into your blood, into your brain, or anywhere else, it first has to figure out how to get past this gate. So how does it do that? Well, it all comes down to what the drug is made of. See, our cell membranes are kind of fatty. So a drug that's also fat-loving, or lipid-soluble, to use the technical term, it can just waltz right on through. It's got the all-access pass. But a water-loving drug, nope. It gets stopped at the door and needs a special escort, like a carrier protein, to let it in. And this one little difference, it changes everything about the drug's journey.
All right, now that we get that crucial concept, we're ready for stage 1, absorption. This is where the pill's first big goal is to get from your stomach and hop onto the body's main superhighway, the bloodstream.
It's a pretty straightforward idea, right? A drug has to get in to work. And it doesn't matter if we're talking about a pill in your stomach, a cream on your skin, or an inhaler for your lungs. That process of moving into the blood is called absorption. If it can't do that, the journey is over before it even begins.
Now for a pill you swallow, this isn't just a single event. First, the solid tablet has to disintegrate, to break apart into tiny pieces. Then, those pieces have to dissolve in the fluids in your stomach. But then comes a really critical detour. Before the drug can get into the main bloodstream, it has to pass through the liver.
And this detour has a name: first-pass metabolism. The best way to think about this is that the liver acts like a toll booth on a highway. It literally breaks down and takes a cut of the drug before it gets to the rest of the body. So, only the part of the drug that makes it past this toll booth actually gets on the highway.
This liver toll directly affects something called bioavailability. And all that means is what percentage of the drug you took actually makes it into your blood ready to work. For some drugs, this toll is massive. Take the common beta blocker propranolol, for example. Its bioavailability is only around 25%. Think about that. 3/4 of the dose gets wiped out by the liver before it can even do anything.
But what if you could skip that whole journey? Well, that's exactly what happens with an IV. A drug given intravenously gets injected right into the bloodstream. It totally bypasses the stomach, it bypasses the liver's toll booth, and boom, you get 100% bioavailability. Every bit of it gets to work.
But a pill you swallow, like the propranolol we were just talking about, because of that tough journey and that first pass effect, its bioavailability is always going to be less than 100%. So the key thing to remember is the dose you swallow is not the dose your body actually gets to use.
Okay, so our drug has survived the stomach, it's paid the liver's toll, and now it is finally on the bloodstream highway. Welcome to stage 2, distribution. It's time to find its destination.
The blood is going to carry this drug pretty much everywhere in the body, but the drug itself is only looking for one specific place, what we call its site of action. So if you've got a headache, that site is in your head. If you've got a sore muscle, that's where it's headed. This is the spot where the drug actually does its work. But of course, there's a catch. The bloodstream isn't some empty road. It's packed with all sorts of things, including these big molecules called proteins. And some of our drug molecules will actually latch onto these proteins and just hitch a ride. The thing is, while they're bound up like that, they're completely inactive. They can't leave the bloodstream and they can't do their job. So only the free drug, the part that isn't stuck to a protein, is actually active and able to work its magic. The bound part is kind of like a storage tank. It'll release the drug slowly over time. But the really important thing to get here is that only the free drug can actually get off the highway and go to work. All right, let's do a quick recap. Our drug got absorbed, it got distributed, and it did its job.
So what now? Well, the party's over, and now the body has to clean up. This brings us to our last two stages, which are all about getting the drug out of your system, metabolism, and excretion.
You can really just think of this as a cleanup crew coming in. The drug's mission is complete, and now the body's main focus is on breaking it down and escorting it out. And where does this cleanup primarily happen? Yep, back in the same place that gave us trouble before, the liver. Now, remember how we said the drug had to be fat-loving or lipid-soluble to get into cells in the first place? Well, to get out of the body, it needs to be the exact opposite. So the liver's main job here is to take that fat-loving drug and, through a bunch of chemical reactions, transform it into a water-loving or water-soluble form. And why is that transformation so important? Because our body's main filtration system, the kidneys, are experts at pulling water-soluble stuff out of the blood and putting it into our urine. So once the liver works its magic and makes the drug water-soluble, the kidneys can easily grab it and kick it out of the body for good. And that final step of removal, that's excretion. And there you have it. That is the pill's epic journey from start to finish. Absorption, distribution, metabolism, and excretion. But, this isn't just a cool biology lesson. Why is it so important to understand all of this?
Well, because this journey pretty much determines everything about how a medicine works. It's how doctors figure out the right dose to give you, because they know some of it is going to get lost at that liver toll booth. It's how they know how often you need to take it, based on how fast your body cleans it up. And it's even the key to predicting side effects and designing brand new medicines that are safer and work even better.
So, let's leave you with this final thought. Every single step on this path we've talked about, from the cell's gatekeeper to the liver's toll booth, even those little protein taxis in our blood, these are all variables we can potentially control. And as we get better and better at mapping this journey, the real question becomes, how can we use that knowledge to design the perfect, custom-made journey for every single pill?